everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Fesoterodine. Its brand name is Toviaz. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Fesoterodine is a competitive muscarinic receptor antagonist. This action prevents contraction of smooth muscle in the urinary bladder. In terms of indications for use, fesoterodine is indicated to be used in the treatment of bladder muscle dysfunction, typically when it's overactive. Now, before somebody was to use fesoterodine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to fesoterodine or any other component of the product, they would not be able to use this medication. They would also not be able to use fesoterodine if they had a hypersensitivity to tolterodine. If a patient had gastric retention or urinary retention, they would not be able to use fesoterodine. And lastly, a patient would not be able to use this medication if they had uncontrolled narrow-angle glaucoma. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population who have delirium or are at risk for developing delirium, because this population may have an induction or worsen of delirium with this medication. We would also want to avoid giving it to elderly patients who have cognitive impairment or dementia because of the CNS adverse effects that they may experience with this medication. We should avoid giving this medication to elderly men who have lower urinary tract symptoms, such as benign prostatic hyperplasia, due to a decrease in urine flow and the possibility of urinary retention. It should be noted that clinically significant bladder outflow obstruction may occur with the use of this medication. Some central nervous system adverse effects, such as dizziness, headaches, and somnolence have been reported, and a dose adjustment may be necessary if a patient experiences these. Patients who use this medication may be at risk of experiencing decreased gastrointestinal motility. Geriatric patients above the age of 75 would be at an increased risk of experiencing the anticholinergic side effects. They may experience dry mouth, constipation, dyspepsia, residual urine, dizziness, or urinary tract infections. It's not recommended to use this medication in patients who have severe hepatic or liver impairment, and we should only use this medication in patients who have controlled narrow-angle glaucoma if the benefits outweigh the risks of using the medication. And lastly, for precautions, if patients had severe renal impairment or kidney impairment, so a creatinine clearance less than 30 milliliters per min, a dose adjustment would be required. So if somebody is using fesoterodine to treat bladder muscle dysfunction when it's overactive, they would typically use 4 milligrams once daily. And then based on individual response and tolerability, they do have the option to increase to 8 milligrams daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using fesoterodine, so I'll go over some of those here now. 4 to 6% of patients may experience constipation. 1.5 to 2.5% of patients may experience indigestion. Dry mouth can happen up to 34% of the time. Up to around 4% of patients may experience dryness of the eyes. And about 1.5% of patients may experience urinary retention. Now, some more rare but serious side effects would be the anticholinergic adverse effects, or angioedema. That's all we're going to talk about today with fesoterodine, or Toviaz. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.